Thanks for coming back to the channel. Today we're going to take a deep dive on fat transfer and what it is and how it's different in my practice. Everyone knows that we can use fat from your body to improve the shape of your body. And the truth is we take fat from one part and move it to another, and that does change the volume. There's a few critical concepts that you need to understand if you're thinking about using fat grafting to improve your appearance, or if you want to add it to your surgical procedure. The first is really related to how much fat we can use and what the result will be like, because I feel like this is the biggest disconnect that I see. Nowadays, when I see patients in my office that are unhappy from a fat grafting procedure, it's because usually they didn't have a deep discussion with their plastic surgeon about what they could achieve and what that would look like after. So I want to take some time to address how much fat we can use and what the results will look like. And it's a pretty basic understanding. If you can understand this, you can understand why we do what we do in the surgical procedure. And then after that, we'll talk about the different types of fat, where we put it, and how it works. First off, important concept. Each fat cell needs a cell next to it to give it oxygen, nutrients, and blood supply. So in a perfect world, if I'm transferring fat into one part of the body, whether it's the butt, the breast, or the face, it needs to have a cell next to it to give it what it needs. So fat can only restore the volume that's there. So if the upper pole of the breast is this thick, then I can add that much fat and it'll be this thick. Same thing in the face. If you have areas where you have no fat, I can only add a small amount, because if you add a ton of fat, it will get resorbed and will not maintain its volume. So think about it this way. If you have areas that are very deficient, you're very deflated, very hollow, you may need more than one fat transfer to achieve the result that you're looking for. You need to understand that. These are physiological limits of what we can achieve. It doesn't matter what the surgeon does, there's no magic involved. If there's not enough cells to give the fat cells the oxygen that they need, you will not be successful in one go. And you need to know that. It's not because of a magical technique that anyone uses, it's just the understanding and the basic knowledge of how this technique works. Now, if you have the right amount of fat transferred into that area, usually what happens is the body revascularizes that fat, it changes shape, and most of that fat does survive and improve the quality of the overall result. Let's talk about the different types of fat that we're going to be using in any surgical procedure. So nowadays there's really 3 different types of modern fat grafting. 2 that we use in the face commonly. The first one is something we call nanofat. What is nanofat? Well, it's a fancy description for taking fat and breaking it down into basically broken fat cells, stem cells, and growth factors. How do we do that? We use a small filter between 2 syringes, and we passage the fat back and forth several times. And over the years, we've created different formulas for how we achieve the right flow and the right kind of consistency of that fat. But for nanofat, generally speaking, it's 20 passes with a 1.2 millimeter guard, or there are other devices and machines out there that help to create that nanofat. Nanofat is particularly interesting because, like I said, it's broken fat cells. It's not really living fat cells, but it is living stem cells and growth factors. We inject small aliquots, very tiny little dollops of fat, from here to here in the dermis. So we're injecting it into the level of the skin that gives the skin its thickness and its quality. And this does a few things. Firstly, the growth factors stimulate new blood cells and new blood vessel growth, and this improves the quality of the skin. Secondly, the stem cells that are there cause turnover and modulate the environment. We don't fully understand how they do what they do, but we do know that they improve skin quality. And thirdly, the broken fat cells that are there do give a temporary volume boost to what's there, maybe similar or equivalent to dead fat cell type therapies like Renuva, which is a form of injectable that we use that doesn't have any living fat, just dead fat cells in it. There's still some data out there that needs to be parsed out, and no one is fully convinced on the effects of nanofat transfer, at least with regards to how much it improves skin quality. But all of us do it because we all see an improvement. And quantification takes time, so keep in mind, all science is not done yet in all these procedures. It's something that we do, we know it looks better, we don't exactly know how and why yet. Now the second form of fat that we use is something called millifat, or I like to call it structural fat. It's basically small fat cells that have not been completely broken apart, some growth factors and some stem cells. But we don't passage the fat as many times back and forth, and we inject it with bigger cannulas so we can maintain the viable fat. This is used in areas where there are fat deficits, the prejowl sulcus, the cheek area, the nasolabial fold, also potentially around this region in the lower kind of bony orbit, and the temples, and sometimes in the brow. Why do we use it? Well, it helps to restore the volume that's there. But again, it's dependent on what is already there. So if you're extremely hollow in the temples, there's only so much we can do to add that volume back. This fat does other things. It improves the structure and the quality, also brings hydration and improves the effect of overall the way things look. And I like to use it for structural purposes. in contrast to the nanofat, which I said we inject throughout the skin. Nanofat, again, can also be injected indirectly into the lips and the other structures like the SMAS in this region to hydrate the tissues and improve the quality of deflated or wrinkly looking kind of tissues. Now, that's nanofat and structural fat, or millifat. There's a third form of fat that we use for breast and for gluteal augmentation. That fat is fat that's very little processing has been done to it. We take it from the body with a large cannula, 4mm basket cannula, and then we inject it back in with a similarly large cannula. That allows us to inject big clumps of fat, basically globules of several fat cells together into the area. And not all of them are well revascularized. Some of them die, but they do provide the volume that we want when we're doing a Brazilian butt lift or gluteal fat transfer or breast fat transfer. And it's important to understand we're doing large volumes in those cases, 600 cc's of fat to buttocks or to a breast, maybe 300 to 400 to a breast. And those fat particles that we put in change the shape and really change the volume on a large scale. These are the three forms of fat. Now, of course, the technique and the transfer matters. So in the article that I wrote, which we'll put a link to here, you can see how we use different techniques to inject this fat into different areas of the body. And what we do when we're injecting breasts and buttocks is very different than what we're doing when we're doing the face. I'm going to focus on the face in this discussion and just defer you to that article and maybe have a separate video where we talk about the techniques, including the vibrating hand piece, the roller pump, and the other things that we do when we're injecting buttocks and breast. With regards to injection in the face, it's important to understand that techniques and technology are very different. But basically, we want to use a cannula that allows the fat to flow smoothly, or a needle if we're injecting nanofat to go to the areas that we want to inject. We also use technology before we actually process the fat to remove oil and other fluids to really dehydrate the fat and make it as creamy of a consistency as we can, so it's not artificial volume that we're seeing on the table. Those are the big differences between the different types of fat that we've kind of gone over. Whenever we're doing a facelift or a weekend lift or any surgical procedure, we're considering using nanofat and structural fat in those areas. It can also be used in the back of the hands and the ears and many other places. But that's usually the fat that we're using for small areas where we want to see changes in the volume and what's in those regions. These are the key concepts with nanofat and structural fat grafting. And we've kind of gone over the basics in terms of what the fat is and where we put it. The last thing I want to talk about is what are the potential issues that you look for with fat transfer. Nanofat and structural fat are critical to use, especially around the eye. Nanofat is the best in that region because you don't want to put clumpy fat in there because you can't remove it. You have to do a surgery to find it and remove it by hand. Now, in regards to buttocks and breast surgery, you can use bigger fat because it's in a deeper layer, it's protected by thicker skin, and it's not in an area that lumpy bumpiness is going to be perceived necessarily right after surgery. The last concept I would say is perioperative management is really key. So in my practice, I utilize nutrition supplements to really give the fat what it needs to survive, and hyperbaric oxygen therapy treatment. Why? Because when we take those fat cells and we move them from one part of the body to another, the first thing they do is cry out for oxygen, and they do that by secreting inflammatory factors. If we give them the oxygen they need, inflammation and swelling goes down, healing and survival of the fat cells is better, and it helps eliminate secondary metabolites from anesthesia, so patients feel much better after the procedure. This is absolutely critical, in my opinion, in order to ensure the survival and the engraftment of the fat that we've used. So these are concepts in fat. We've gone over a lot of information on nanofat, structural fat, and other type of fats that we use for surgical procedures. There's going to be more information that we give during the consult, but take some time and dive a little bit deeper into these concepts. Hopefully this video is educational and you understand a little bit more about the different types of fat and what we use in different surgical procedures.